Hi, good morning, Darren. My name is Bestie Muller. I'm your invigilator for the OET speaking session on the 28th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Darren Massey.
And what is your candidate number, please?
My candidate number is 256144103.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What would you describe as your strongest nursing skill?
The strongest skill I have as a nurse is being able to assess a patient's symptoms and diagnosing what illness they may have. I've gained this ability over time by carefully observing the symptoms and listening carefully to the physician's diagnosis. On some occasions, I am even able to point out something the doctor may have missed, which is crucial to an accurate diagnosis and treatment plan.
How involved were you with patient care during the COVID-19 pandemic?
Working during the pandemic was one of the most challenging things I've ever done. As you're probably aware, nurses were on the front lines and had to put in long hours in tough circumstances. Additionally, we were putting our own lives at risk by exposing ourselves to possible infection. What got me through it was the camaraderie of the entire hospital staff, as well as the knowledge of how vital our work was. I am now confident that, no matter what happens, I am strong enough to face it and able to get through it.
What's the hardest thing about being a nurse?
For me, the hardest thing about nursing is the physical side. Being on my feet for an entire 12-hour shift, working night shifts, and lifting patients takes a toll. I take weekly yoga classes and do CrossFit for stamina and endurance. The stronger I am physically, the better I can deal with whatever nursing throws my way.
How well do you work with other nurses, doctors and staff?
During my clinical training in the emergency response room, I learned how important it is to communicate well with other nurses. For example, I make sure to consult with a senior nurse or doctor whenever I administer a new treatment or medicine to patients. Often, doctors know the medical history of their patients in detail. So, I find it best to consult with them rather than go by the demands of the patient.
Tell me your feelings about being a nurse.
Being a nurse every day challenges my critical thinking skills. And there is never a boring day at work. I have the pleasure of meeting people with diverse backgrounds from all walks of life. Definitely, I know I'm making a difference. As a nurse, I'm always learning something new. Yes, I feel proud and satisfied being a nurse.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Darren Massey. I am the community nurse working in this locality. For my confirmation, am I speaking to Betsy Muller?
Good morning, Darren. Yes, I am Betsy.
Nice to meet you, Bestie.
Nice to meet you too.
Bestie, the purpose of my home visit is that your GP has informed me about your leg ulcer, and I am here to check on the progress of your recovery, and to ensure continued care.
All right. That's great.
And, how are you feeling now?
Well, I am feeling quite worried about the effect of the ulcer on my life.
I am really sorry to hear that, Bestie. Try not to worry. I am here to help you. For a better understanding, may I know what exactly bothers you?
Nurse, I don't know why I need such bulky and tight bandages. They are quite uncomfortable.
I can realize your concern, Betsy. But you should understand that it is really important to have layered compression to prevent swelling of the wound site.
Oh, is it?
Yes, this kind of bandaging is also called pressure therapy, which is employed to improve the healing rate of wounds, especially in venous leg ulcers.
Really?
Yes, Bestie. Also, this type of bandaging helps to measure and transmit real-time information on the temperature, sub-bandage pressure, and moisture at the wound site. Am I clear to you?
Yes, you are.
Thank you for your understanding. Meanwhile, I would like to suggest that you need to move the ankle around to increase the blood circulation, which could promote wound healing.
Yes, nurse, I regularly move my ankle, but I have limited my general physical activity to encourage the ulcer to heal.
Good to hear that. However, resting too much is not good, and it is mandatory to walk 10 to 20 minutes in frequent intervals, with adequate rest.
Oh, all right.
And also, you should check for changes of color, the temperature, on the foot. It is to identify if there is an infection present.
Okay, I will have a check on it.
That's perfect. Another important thing to be noted is that it will be great if you keep the leg raised when resting. I mean, raise your leg with a pillow when you lie down, and raise your leg to a higher surface while sitting.
Okay, I will take care of it.
Great. If you don't mind, shall I ask you a personal question for therapeutic purpose, please?
Sure, you may proceed.
All right, could you please tell me about your social life and your general mood after the occurrence of ulcer?
I can say that it is quite disturbed.
Oh, disturbed. Can you please brief it to me?
As you can see, after the occurrence of an ulcer, with this big and odd dressing on my legs, it is really hard to go out. Everyone looks at me like an alien. I am not comfortable with such a situation.
I know how hard it is for you.
And nurse, for the same reason, I started to avoid going out and meeting known people. Whenever people find me out, they ask me many questions, and answering them seems to be very difficult. I hope you can understand.
Yes, I acknowledge your situation, Bestie. And what I can say at this point is, if you are following my suggestions, I can assure you that you can get faster recovery from this.
Yes, definitely. Because nurse, a complete healing is really needed for me to continue my social life and to get rid of this depressive mood.
All right. By the way, for the time being, I can suggest you to keep in touch with the local sources of support, such as special day centers, social clubs, etc.
Okay.
Thus you can get enough support and encouragement to live a peaceful life, coping with this situation.
Yes, that seems to be a good idea.
Fine. I can provide details of these support groups, so that you can contact them easily.
That is so kind of you, nurse.
I am glad I could help you in this situation. I hope I have clarified all your doubts.
Yes, nurse, you have.
Thank you for listening to me, Betsy. If you have any queries, please feel free to contact me. I wish you a speedy recovery.
Thank you.
Great. Have a nice day.
To you too. That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please
like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.